For more context on the virus, let's go now to an expert, Dr. Todd Ellerin. He is Chief of Infectious Diseases at South Shore Health in Massachusetts, and he's been responsible for deciding which patients at the hospital are tested for coronavirus. So first off, Doctor, thanks so much for joining us tonight.
Thank you.
What kind of symptoms are you looking for specifically?
So with this COVID-19, the symptoms are very similar to the flu. So you're looking for fevers, a cough, possibly shortness of breath, aches, very flu-like.
We've heard a lot of different reports on how the virus has spread, including some who have said that you can even get it from plumbing. So is that true at all? I mean, can you give us a sense of how the virus does in fact spread?
Okay, so remember, coronaviruses are something we've been dealing with for a long time. They're responsible for the majority of common colds. So those are the typical symptoms. This, of course, is a novel pathogen. And remember, we think that person-to-person transmission in close contact is generally how this is spread. Now, can this be spread through pipes? It's still too early to say. I think we have to remember, wherever this was, there's likely other people that may have the virus. There could have been a common contact. There may be other explanations. So we don't know yet, but that remains to be seen.
And what exactly can you tell us about the pathology of the disease and how it first originated?
Well, we don't know the exact origins, but coronaviruses often come from certain mammals like bats. And again, there may be an intermediate animal that was infected before it made the jump from animal to human. But you know, this animal to human transmission was common for SARS. It occurred for MERS, which was in the Middle East recently, and that may be the case with this COVID-19. But again, the origins are still obscure.
And the CDC has screened more than 30,000 passengers at the 11 airports designated to take in flights from China. So what kind of concerns should international travelers have?
Well, I still think it's important to remember this is still a tale of two epidemics. We have one going on right now in Wuhan. Okay, but we have one right now in the United States, and that's influenza. There are over 22 million people that have been infected, over 200,000 hospitalizations, and over 12,000 deaths. So right now, even in international travelers, if you have a flu-like illness, it's much more likely to be run-of-the-mill influenza that we're used to, as opposed to COVID-19. With that said, this is a serious pathogen. We want to make sure it doesn't spread around the globe. We have to make sure it doesn't become a pandemic. And in doing so, we have to take basic infection control procedures like early identification, isolation, and then contact tracing, and perhaps quarantine when we think that's necessary. And that's what will stop this from becoming a pandemic.
We talked to a patient the other day who actually had tested positive for the virus, and she said that she's experienced much worse colds. I mean, so how bad is it or does it just depend on somebody's system and how much it may be compromised?
I think, again, the symptoms can be variable. Most patients do not have severe disease. For most people, it's more like a cold or a mild flu-like illness. But for the more severe patients, you can get a very severe pneumonia that can require intensive care unit, and obviously, at times, this can be fatal.
All right, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Hospital. Thanks so much for joining us tonight, Doctor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.